Hello, my people. Good afternoon, good evening, good morning, wherever you're watching me from. Welcome back again to Abimbola Talk episode of today. I would really appreciate you for so far, so good. Thank you for listening to all our talks. My name is Abimbola Olare. I'm a women's health nurse that has passion about mental health because our mental health is very, very vital to our life. So today we are talking about postpartum depression, and this is predominantly for immigrants. I know mental health does not discriminate, against races, but we have to be aware about, of it. My people in diaspora, please, I want you to listen to this and share and share and share so that we can learn about it and know when to seek for help. So, what is postpartum depression? To a woman that just had a baby, to a woman that just lost a baby. So it is an affective disorder experienced by 1 in 10 women. When we say 1 in 10 women, that means it's very, very high. The statistics is very high. So definitely many people are experiencing this, but they don't just know because they don't know what is going on. So you are not alone. It is not like, oh, nobody else have experienced it before. So that is why you have to know that this is common to many women. And it is experienced between 8 weeks and 1 year after delivery. So that means even after 8 weeks of having a baby, up to 1 year, you can still experience what is called postpartum depression. And we do encourage obstetricians, doctors to utilize what is called an Edinburgh postnatal depression scale. So even we encourage them to start using it for their patients from the prenatal care. So by the time you go for your antenatal care, which we call antenatal in Nigeria, so that you start looking at the scale. The scale is not a yes or no. It is how you are feeling. Are you feeling this way? So you tick it. So if there's anything that kind of projects you towards having a postpartum depression after delivery, then it can be recognized while you are still pregnant so that there is a plan towards future. So the symptoms right now is because the reason why we are talking about the symptoms is because many people have mistaken it for the normal blues that happens after delivery. There is loss of esteem that, oh, what am I, I can't, I amount to nothing. I can't do anything right. My baby is not even feeding well. I'm not a good mother. What the stories I have heard about people, is am I doing it? Am I really doing up to par with what I'm supposed to do? And also lack of sleep. I know when you just have a baby, definitely there will be lack of sleep. There are some babies that are binge eaters. Definitely when they tell you you must practice what is called exclusive breastfeeding, talk to your doctor, talk to your midwife, and also seek an advice from lactation consultant. Not everybody lactate within 1 or 2 days. Depends on how many weeks gestation you wait before you have the baby. And also, some women naturally, they don't lactate as much as some other people. And the size of your breast does not determine how much milk comes out. So you have to know that. So if your milk is not coming out at that time as it should, talk to a lactation consultant. What can I do so that my milk can come down? And even if you are not having enough, can I supplement at this time? You can syringe feed. We are still going to talk about that so that you will be able to, have enough for your baby so that baby will not be crying. But let me tell you, there are still some babies that cry all night. It doesn't matter if they are hungry or they are not. Babies seek for attention. So there is lack of sleep when you just have a baby. So, but still compounding it, even when the baby is sleeping, you still can sleep. So those are one of the symptoms of postpartum depression. And this might range from mild to psychotic episode. There are some people that already have an underlying, disorder that they don't know, because psychosis does not just show its face like that until you are stressed. So that's what is going to bring a psychotic episode out. So it depends on the severity and underlying history. If you have a family history, or you already have it, that is subtle, that is benign, postpartum depression will now push it out, and you can now have what is called a psychotic episode. So most of the time it is not understood. It is misunderstood that, oh, I can't sleep. Maybe it's because I just have a baby, But you have to recognize the sign for you to be able to seek for medical advice before it escalates. So for now, my people in diaspora, why are immigrants more susceptible to postpartum depression? Because I see a lot of women, I've heard about stories of women that came to join their spouses abroad. And by the time they have their baby, because peradventure, the man, was a lone ranger, is being, having some ego, don't talk to people, do not associate with people of your tribe. So at the end of the day, you are by yourself in the house. There is no help, so anywhere. The husband is going out to go and fend, try to, because you are not working at that time, you just have a baby. The bills has to be paid. We have to buy milk for the baby. The house needs to be kept. The light has to be on. Everything still has to be working. So he has to be taking on extra work in order to be able to keep the home front running. So it's not at home. Sometimes it's not even his fault. And also, well, some men are home, but because of the African mentality that it is the woman that birthed the baby, so she should be the one that should be able to take care of the baby. Some men will just sit down, put their feet on the table. When the baby is crying, they will call you, oh, honey, the baby is crying. They will not pick up the baby and change the diaper. That is African mentality. So one of the reasons why more immigrants are more susceptible is lack of awareness, because we don't know. We don't know what is called a postpartum depression. In my language, in Yoruba, we call it abisinwi. So that means when you have a baby and you just go crazy. Definitely back home, most people does not recognize postpartum depression. They just say, oh, it's your village people that have started. Oh, maybe your mother's father's other wife at home, your stepmother. Maybe she's the one that is sending missiles from home. That's why maybe they don't want you to have children anyway. But let me tell you, it is not everything that is village people. There are some things that do happen, just because of some issues that happen in your life, some milestones that happen in your life. So postpartum depression is not one of the village people missiles. So do not have that misconception. So you have to recognize it, because we are not aware. So that is one of the reasons why immigrants are more affected. And also the fear of being stigmatized. Oh, I don't want people to know that I'm going to a psychiatrist. Anyone back home, even before I came to a developed country, if you go to a psychiatrist, that means you are crazy. But in developed countries, if you want to talk to a mental therapist, you go to a mental therapist. They are psychologists, they are psychiatrists, so that you don't go crazy. So that is why you talk to a mental therapist. So the fear of being stigmatized. But let me tell you, when you have the fear of being stigmatized, at the end of the day, it's going to lead you to somewhere, to a situation, to a point of going through that episode that you were supposed to avoid. at the end of the day. So I've seen, couples that, the woman had to end up in psychiatric homes. And that is very, very devastating, especially for immigrants, but there is nobody to help. So if you are able to recognize these symptoms, it is time for you to talk to your medical provider. I just can't sleep. And that is why there is something that is called 6 weeks postpartum check. So by the time you go back to your doctor's office, 6 weeks after delivery, the doctor is going to ask you, how are you feeling? How's the baby? How is breastfeeding? Are you bottle feeding or are you supplementing? All those questions. So at that time, you are bound to answer, oh, I'm not feeling well. This is what is going on. Even if after 6 weeks postpartum, maybe 8 weeks down the road, or 10 weeks or 12 weeks, you are feeling down, depressed, you just think I'm not a good mom because I'm not able to breastfeed. And you see, there are some people, all those know it all. They will tell you, when I had my baby, I was able to breastfed my baby until she was 18 months. Or I breastfed my baby until she was 2 years. Why are you not breastfeeding? Let me tell you, everybody's body is different. The way we are physiologically made up is different from one person to the other. So do not listen to all those telltellers that will now come to your house and tell you what to do, how to take care of your baby. So because by the time they tell you all those things and leave, it's going to give you the impression, I'm not a good mother because I'm not lactating. I'm not feeding my baby well as I should. Let me tell you, you are not different. So many people, when you talk to other people out there, they will tell you, because our body is not made up the same way. Some are cows when they milk, so to say, and some, they don't even lactate more than 6 weeks. That might be you. So don't force it. If you are not able to, if you are not lactating well and you talk to your provider, everything that she say or he says you should do and you do it and it's not working, don't kill yourself. You can supplement. You can give the baby, some formula, but try to breastfeed first. If it does not work, then you go to formula feeding so that your baby will not be crying all day, all night, and you won't be able to rest. And at the end of the day, you go through what is called a postpartum depression. Then the fear of being isolated.